Thank you so much for your interest in taking on one of the biggest foster challenges, the care of our tiniest, most fragile guests. In the first section, we will go over guidelines for fostering mother dogs and cats with babies. Fostering a mother dog or cat with her puppies or kittens is a huge job with a potentially long foster term. Sometimes it can take 8 to 10 weeks to get puppies and kittens big and healthy enough for adoption. Fostering a nursing mother and her babies is not for everyone, although the rewards of watching mom care for her puppies or kittens and helping those puppies or kittens develop into healthy, happy dogs and cats is immense. Foster requirements for moms and litters. It's really important to have a room that is completely separate from all other pets, as mother animals tend to be very protective of their babies. For dogs, a whelping box. For us, a plastic wading pool is great and easy to clean. For cats, a crate can be used as well. You'll need a minimum 2-month commitment for the mom and puppies, as moving them from foster to foster can be very stressful. You'll also need to have the ability to be able to bottle feed and care for the babies in the event that mom is unable or unwilling to care for them for the entire 8-week period. It can be a messy job and is not for the faint of heart. This chart goes over major development milestones for suckling puppies as well as the foster's responsibilities during that time. You will also receive a hard copy of this information in your foster care handbook when you complete this training. Here's another chart tracking kitten development and foster responsibilities for moms and kittens. Again, you will receive a hard copy of this chart upon completion of the foster care quiz. Only our most dedicated fosters take on orphan puppies or kittens, as they require round-the-clock care. Many of these babies end up in our shelter as orphans, and there are many reasons as to why they end up alone. Very often, these little creatures get separated from mom or mom disappears, whether it's from getting lost or from predators. Mamas are the best chance of survival for neonates. After all, mother knows best, but you are the next best thing. Here you'll find a list of essential puppy supplies needed for fostering neonatal puppies. A heat source is very important. The electronic heating pads are fine, but we love the Snuggle Safe as it's microwavable. It'll hold its heat for 10 to 12 hours and you don't have to worry about an automatic shutoff. Infant baby bottles work great. Our favorite are the Dr. Brown's line. We use the S-Black from Pet Ag for puppy formula. Oftentimes we are able to provide this at the shelter. We also love pet wipes for stimulating elimination and spot cleaning neonatal puppies, though tissues, cotton balls, or toilet paper will work just fine. For the first 2 weeks, we like to keep our suckling puppies in a plastic container or laundry basket. It's easy to carry around and easy to clean. An X-Pen kennel is great once the pups are up and moving and need a little more space. You're also keeping them safe away from things that could harm them and away from household pets. And then you're also going to need a good supply of towels and blankets that get washed daily. And here is the list for kitten supplies that will be needed. The same heat source that we like for puppies is the same for kittens. As far as bottles and nipples, we love the Miracle Nipple. It seems to be the best one to get a good latch. We also use KMR formula by Pet Ag, and we will supply that whenever possible. The other differences you'll note are a litter box and a non-clumping cat litter. Our favorite is yesterday's news, as well as an enclosure as the kittens get older and need a safe place to play. Normally, kittens and puppies should begin weaning around 4 weeks old and can be fully weaned by 7 to 8 weeks of age. This is around the time the mother begins pushing them away when they try to feed. If you've been bottle feeding newborns, it's okay to begin this process around 5 weeks of age. Start the weaning process by separating the babies from their mother during feeding time, usually 3 to 4 times a day. For both puppies and kittens, you'll want to transition them eating from a shallow plate or bowl. Both species need to start out with a soft meal before fully transitioning into eating dry food. The weaning process may not be a smooth one, but don't panic. There are some things that you can do to help the process along. Allow the puppies or kittens to lick the food mixture from your finger, then guide them toward the bowl where they will smell the food and begin to understand the bowl as a source of food. If the babies are rejecting the food mush, you can take a step back and offer them milk replacer in a bowl. The first step is to get them used to eating from the bowl. Once they are used to eating from the bowl, you can try to reintroduce the food mush. You'll also want to be sure to avoid these potential hazards to the litter. Do not try to force the puppy or kitten's face into the bowl. This may cause them to inhale the food and choke or develop pneumonia. Any uneaten portion of milk replacement should be removed after no more than 20 minutes, even if it's been added into a soft food. Keep track of the litter's progress by weighing them regularly, at least once a week. If you're concerned about the health of your puppies or kittens, you'll want to understand if the litter is progressing normally, contact the clinic for a sick appointment as soon as possible. Early detection and treatment of illnesses in puppies and kittens is key to keeping them healthy and getting them ready for adoption. If you notice watery, crusted eyes, sneezing, lethargy, coughing, vomiting, diarrhea, missing fur or scaly skin, lumps on the body, not eating or drinking, limping, bleeding, constant crying, or excessive scratching, it's important to contact us right away. Your point of contact for a sick foster pet is going to be Veterinary Clinic Supervisor Sheener Perry. She can be emailed at sperry@mail.maricopa.gov or call directly at 602-506-7239 for an appointment with our shelter veterinarians. Please be aware that if you choose to take your foster to an outside vet, the shelter is not able to reimburse you unless you have pre-approval. Inappropriate suckling is a common problem for orphan puppies and kittens. Diligence in monitoring your fosters will help prevent major complications. Keep in mind that kittens and puppies are born blind, deaf, and mostly helpless, but the one thing they can do for themselves is suck. They latch on to one of their mama's nipples and nurse every few hours in those first few weeks as they develop and grow. For the most part, kittens and puppies are pretty indiscriminate suckers. Some of the little ones will nurse off of anything they can get their mouths around, which may be a litter mate's belly, limb, or nether regions. The act ostensibly offers the kittens or puppies a feeling of comfort as they associate it with feeding from mama. Besides the possible ick factor, dry suckling can be detrimental to both the sucker and the suckee. The unlucky kitten or puppy on the receiving end of this inappropriate nursing can develop lesions and other injuries. Dry nursing can develop into a habit, becoming harder to break as a kitten or puppy matures. The one thing that will stop a kitten or puppy from nursing inappropriately: separation. When you notice two kittens or puppies connected in a way that no two kittens or puppies should ever be, gently pry them apart and separate them. If you've noticed this behavior in your bottle kittens or puppies, they should always be separated unless supervised. Fading puppy and kitten syndrome can be heartbreaking to watch. We must understand that not all orphan puppies and kittens will survive, but please know that their chances would be much smaller without you. The failure to thrive in newborn puppies and kittens, or neonates, is often labeled as fading puppy and kitten syndrome. The syndrome can occur from birth to 9 weeks of age, but it is usually reserved for nursing babies. Affected neonates can decline quickly and die, so immediate detection and treatment are key to survival. Overall, neonatal mortality In puppies varies from 12 to 36%, while in kittens it is 15 to 40%. Be sure to know what to look for if you see any of these warning signs: weakness, failure to gain weight, staying away from the rest of the litter, failure to suckle, crying and crawling from being uncomfortable, diarrhea, cyanosis, or blue baby. Occasionally, sloughing of tails and toes tells us we are missing the signs of illness. If you notice any of these symptoms, you should contact the clinic supervisor for an appointment with the vet immediately. Preventative care like vaccines and deworming are essential to the overall health of your foster. We will help to remind you when vaccines are due. It is also important to keep puppies and kittens away from unvaccinated animals or communal areas like dog parks and pet stores. A tracking sheet will be provided to keep you informed of any preventative care or treatments that will be due during the animal's stay in foster care. It's good practice to always bring this sheet with you to appointments at the shelter. Puppies and kittens should begin to receive vaccines and oral dewormer at 4 weeks of age. Then, a vaccine booster is repeated every 14 to 21 days until they reach 16 weeks of age, or 4 months old. There is no set number of vaccines a puppy or kitten should receive. They are not fully vaccinated until they are over 4 months of age. You can email foster@mail.maricopa.gov to make an appointment for vaccine administration. We are always happy to have you come into the West Shelter Alternative Placement Office or to meet you in your car so that your puppies or kittens have very little exposure to the germs in the shelter. At the West Shelter, booster vaccines can be done without an appointment through the Lost and Found. Just take a number to be seen. You will have to wait. At the East Shelter, you may complete booster vaccines without an appointment. You follow the yellow line on the floor to the animal receiving area. You will also have to wait to be seen. It is the responsibility of the foster to set up appointments for vaccines and to ensure that the animal is kept up to date. Failure to have your puppies or kittens vaccinated in a timely manner will result in removal from the program. When your puppies or kittens reach 8 weeks old and are at least 2 pounds, it's time to schedule their spay and neuter surgeries. It's best for the overall well-being of puppies and kittens to stay with their mothers and or their littermates until they reach at least 8 weeks of age and are at least 2 pounds. Smaller dogs and cats may need a little more time. It's also important not to keep your foster puppies or kittens too long. Failure to return puppies and kittens for adoption in a timely manner may result in removal from the program. You may pre-adopt your puppies and kittens while they're in foster, but the animals cannot be released to the adopter until they've been spayed or neutered. Typically, the handover takes place on the day of the surgery. The adopter processes the adoption and picks up the animal that afternoon. Please indicate when scheduling surgery appointments if individual animals are already reserved for adoption. Foster surgeries can be scheduled at either shelter location Tuesday through Fridays. Drop-offs are 7 a.m. to 8 a.m. To schedule an appointment for surgery, email foster@mail.maricopa.gov. We are dedicated to preventing unwanted litters of puppies and kittens. It's very important that you never release a mother or babies without first having them spayed and neutered through our vet clinic. When it comes to our tiniest of fosters, the type of cleaning products we use does matter. When choosing disinfectants, keep in mind the diseases you are targeting and the age of the animals you're caring for. In the cattery and kennel, viruses are always a concern, but we must never forget to prevent ringworm in pregnant moms and babies. Often, this requires 2 different disinfectants, one for the adult area and another one safe to use around babies and newborns. Let's summarize some common disinfectants to help you make the best choice. Bleach. Bleach is typically where we start, and it is excellent against parvovirus and panleukopenia. Bleach is effective at 1 ounce per gallon. However, bleach does not penetrate organic matter. It will sterilize the surface of smeared stool or fat, but it will not penetrate the surface to get the virus underneath. It's really important to remove all organic matter. At 4 ounces per gallon, bleach will kill fungi, but with a price. Humans and animals can get skin irritation and moth-eaten puppy coats at that level. Bleach at 4 ounces per gallon also pits stainless steel, dissolves cement from stone, and roughens concrete floors by dissolving the surface. For fungus, Chlorhexidine solution kills fungal spores and is an excellent disinfectant around nursing puppies and kittens. Use in a spray bottle for daily cleaning in nest boxes, especially in catteries where fungal ringworm is the #1 concern for kittens. It's excellent against bacteria and most viruses, but it is not effective against the parvovirus family. Chlorhexidine is also a good choice to disinfect instruments. Chlorhexidine solution can be picked up at any drugstore. A treatment option for cloth surfaces is HealthGuard laundry additive and disinfectant. It disinfects the laundry without harming your washer. It kills bacteria, fungi, and viruses when used in a washing machine. It works well for odor removal as well as cleaning and disinfecting carpet or upholstery. It's safe to use on items that will be around mom and babies. Where fading puppy and kitten syndrome is concerned, our disinfectants matter. When using disinfectants, it's important to follow the correct directions for dilution. Toxins are a major cause of fading puppy and kitten syndrome. Neonatal skin is thin, and chemicals are readily absorbed through the skin, causing fading puppy or kitten syndrome. Breathing chemical fumes can also cause upper respiratory infections. Use caution when cleaning a whelping or queening box or around any suckling puppies or kittens. Avoid any cleaners with pine oils and phenols, like Lysol products, as well as bleach or quaternary ammonia. So any pine sol, Lysol, anything that ends in sol is not safe for use around puppies and kittens. Use gentle cleaners with little odor and baby-safe disinfection around puppies and kittens. The ultimate goal is to have healthy moms and babies. Thanks, guys. You've made it to the end of our video. Now it's time to take a short quiz. Follow the link below. Once we receive your quiz results, you'll get a confirmation email containing your handbook and the rest of the training materials. Thank you so much, Foster Superheroes.